Good afternoon, everyone, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today we'll be having a Q&A on post-COVID syndrome, the end of the PHE, and all other topics related to long-term care. We'll open with a pre-submitted question. If you have a question for our panel, you can submit it using either the chat or the Q&A tool. And if you would like to ask your question out loud, you can raise your hand to request to be unmuted. We invite you to join us every Wednesday at 2 p.m. for more webinars in this series. Next week's webinar will be giving a preview of a course we have coming up called Staffing Solutions for Nursing Homes. And now I'd like to briefly introduce today's panelists. We have a couple of our quality improvement specialists here today, Deborah Wright and Penny Imes. And we're also joined by our infection preventionist, Jennifer Brown, and Quality Insights Medical Director, Dr. Jean Storm. Now with the holidays, we've only received one pre-submitted question this week. So if you have questions, go ahead and start putting them into the chat so that we can answer them after we get to this one. So our pre-submitted question was regarding the changes with the nurse staffing and PPDs. Can CNAs or LPNs be counted if their position is restorative? They do not have an assignment, but are working with residents for ROM, etc.
So, Kathy, I'll take that one. Now, while I'm going to do my best to answer this in the way that I have interpreted the regulations and the guidance, we do not profess to be experts in this. So this is my interpretation of it. And we'll go from there, and hopefully this will answer your question. So as we all know, this weekend on July 1st, the new staffing requirements for Pennsylvania, I just want to be clear with that, this is Pennsylvania, not West Virginia, went into effect that the minimum PPD needed to be 2.87 hours of direct resident care for each resident. And they define that as only direct care provided by nursing service personnel can be counted towards that total number of hours of the general nursing care required. Now, there are some, they did give some examples of what could not be counted in that PPD, and the examples that they gave, while they're not all inclusive, but they included people on orientation, light duty nursing staff, the RNAC staff, hospice, private caregivers, feeding assistants, nursing students, and unit clerks, even if some of those individuals may be nursing assistants. They did go on further to explain that light duty could be counted if they were providing direct care, such as nail care, feeding, and one-to-one assistance. And they further explained that lunch times could be counted if the staff member was still on duty, meaning that they were physically present and in the building and could be pulled if help were needed. You cannot count your lunchtime if you're going off-site. So, that kind of goes in one sentence. They're saying you can't count those that are on light duty, but then they give examples of where light duty could be counted if they were doing direct resident care. They also said that nursing staff accompanying residents on appointments could be counted, and that managers who don't normally provide direct care, but they're needed because of call-offs, should be counted, but you have to make sure that you can provide proof that those hours were direct resident care so that they could be counted in your PPD. So in regards to the initial question, can a CNA or an LPN be counted if their position is restorative? I think you need to be very careful. I think it depends on their job description. I think you need to review this job description, make sure it specifically states if they're providing direct care, what is that direct care that they're truly providing, and how much of their time is spent on direct care. So while they may be out on the floor doing restorative or ambulation programs, and that's direct care, maybe that's only half of their day, and the other half of their day is doing something else. So I know that doesn't really answer this person's question completely, but my recommendation is to look at the guidance and look at your job description, because I have heard of buildings where they've already started to look at this even before July 1st. And it all goes back to their job description. So make sure that you've updated, reviewed, had them sign, any new job descriptions and how you're going to count that and defend it if you do count it. I mean, we've already heard where RN staff are being challenged as to whether the RN that's on duty should be counted in the PPD. And it goes back to your job description and making sure it states what that direct resident care is and how you have it set up in your payroll. It may be something where an RN supervisor is 50% of their time is counted towards direct care and 50% of their time is coded towards administration. So again, it's not a simple answer. It's one that needs to be looked at the facility level, following your job descriptions and how you have it set up in payroll.
Thank you, Deborah. We did get a question from the audience. It says, does anyone have a sample of their new COVID policies since we've had all of the new updates? I guess is that more of a question to the group?
I think that would be a question to the group. So if that's something, Amy, that or if anyone wants to share that with Amy, if you want to send that to Penny or I, we would be happy to see that Amy gets that. If anyone has any questions that they don't want to put in the chat, if you want to come off mute, you can raise your hand and Kathy can unmute you.
Actually, I think I do see a hand raised. But where is it? There it is. Okay, hiding at the top. All right. You should be able to unmute yourself now, April. Actually, April took the hand down, so maybe April didn't have a question to ask out loud.
Just a mistake.
That happens. All right, Deb, I think you said some people in the group had other topics to discuss while people think of their questions.
Sure. So I'll talk about what we have some things that are upcoming, and while I'm talking, I'll just do my part, and then Penny and the others can talk. We all know also we have the new MDS that is going to be coming into effect on October 1st. So we will be devoting the month of August. These weekly webinars will be devoted to those MDS changes. Each week we'll take different sections of the MDS. So I encourage you to look at what topics we're going to be talking about, so that if there's somebody that maybe typically doesn't attend these sessions, but it's their discipline, such as a social worker, you can invite them and have them also attend. And if there's any questions that any of your staff have in regards to the new MDS, they can feel free to reach out to myself, and I'll be happy to work with facilities and make sure that you have all the information, as October 1st is going to be here before we know it. And there's a lot of changes that are more than just, okay, now we have to code this on the MDS. They're actually processes that are going to have to be put into place at the facilities. So it's best to start looking at those processes and start collecting that data now and having the process in place. So if there's things that we can do to guide you with that, we will certainly do that. But like I said, we'll talk more about that in August. And hopefully more of your IDT and MDS team will be able to join on their respective weeks.
I can talk a little bit about something that's just the new regulation that started July 1st in Pennsylvania. And I think we had one or two questions about the new requirement that all medical directors of facilities in Pennsylvania are required to have 4 hours of CME in the area specific of post-acute or long-term care or medical direction. I think 2 facilities reached out to me looking for places where they could direct their medical directors, because it's not going to be your medical director who's going to, I mean, you might have a medical director who's up to date on the regulations, and so they might on their own go ahead and pursue their CME that has to be specific in the area of post-acute and long-term care or medical direction of a long-term care facility. So you might get lucky and have a medical director who does that on their own. I think more likely each facility is going to have to tell the medical director, you really need to get this CME. And I would say, I think it would be a really great idea to tell the medical director where they could get it done. I am thinking about putting together a package of 4 hours of CME specific to long-term care, post-acute and long-term care medical direction. I'm a certified medical director, so I can do that. I want to make sure that there's enough interest. So if you are interested in receiving that education, it would just be like a 4-hour package. You can go ahead and reach out to me directly, or any of us, letting know your interest, and we can gauge that and put it together. I will say, California now has a requirement that every medical director needs to be a certified medical director. So that is a requirement that is coming to effect in California, I think at the end of this year or the beginning of 2024. So I think all states are really moving this way and having medical directors of long-term care facilities to have education specifically to address their job in long-term care facilities. So I think it's really important. You really can't kind of go into a facility as a physician, I think, and just think you're just going to practice general medicine. I mean, it's very specific. So if you have any questions about this requirement or any issues in talking to your medical director, feel free to reach out to me directly.
Thanks, Jean. And I put Dr. Storm's email in the chat. It's jstorm@qualityinsights.org. And Deborah Wright put her contact information if you want to reach out about the MDS changes. It's dwright@qualityinsights.org.
Hi, everyone. I wanted to address a question that came through one of my colleagues regarding metrics for community transmission for respiratory viruses, including COVID, with regards to masking requirements and when to change the amount of masking that you're doing in your facility. So what I'd like to do is share a link to the CDC COVID data tracker. And that is a link from the CDC. I'm just going to put it in right now, which tracks the weekly hospitalizations, deaths, and vaccinations. So you can take a look at that to see in your community the trends that are available. So.
All right, thank you, Jennifer.
And I wanted to mention one of the things that we always do at the end of these webinars is ask you for your feedback for your evaluation and also topics of interest. And so far, what we've been getting back from people are, the regulatory updates, which we're really trying to stay updated with those, and that, the staffing updates, all of the Pennsylvania regulatory updates, anything that comes out from CDC, CMS, we try to make sure that you have that information. The other topic of interest that we hear back a lot is on infection control issues, UTIs, assessments, antibiotic stewardship. So we are hearing what you're saying. We're trying to make sure that we get those webinars out there for regulations. That's part of that series of the MDS. Those updates are coming. That's something that you have to have in place. And so that webinar series is upcoming. Any other more specific infection control areas that you'd like to hear about? I think we do quite a good bit of infection control, but anything more particular that you'd like to hear about? We want these webinars to be worthwhile to the people who are attending. We can talk about all kinds of different things, but unless it's something specific that is helping you in your nursing home, you and your staff move forward with what you need to do, it's really, it's a better use of our time if we get that feedback for exactly those types of things that you'd like to hear about, if there's something outside of that. I don't know, Jennifer, if you wanted to talk a little bit, again, a reminder, and I know we put this out in the newsletter, but I think, we've had a lot of individual outreach from some nursing homes and their infection control preventionists. I know there was a lot of turnover over the last year in that role. And so you have a lot of new infection preventionists, and Jennifer has offered the infection control boot camp and the offering that outreach to nursing homes. So I don't know if you wanted to just, again, a reminder of what you have to offer. And I know a couple infection preventionists who had the discussions, conversations with Jennifer, and they let me know that it was really good and really useful.
Thanks, Penny. Yes, we offer a lot of support resources for infection preventionists. In addition to the electronic resources that we have in our webinars, we do offer on-site visits. And the on-sites can be, whatever you are focusing on right now. The on-site visit can be, a comprehensive review of your infection control program, which includes a review of your policies and procedures, and also a walkthrough of your facility to point out any areas that may be something to, look at the quality improvement for. Also, if there is a new infection preventionist or someone who is new to the role in the facility, we do on-site one-on-one technical assistance where we can focus on, whatever pieces of your infection control program that you'd like to focus on. In addition to the one-on-one support, we are piloting our infection preventionist boot camp this fall. This program will pilot in West Virginia first. And it is a comprehensive program to discuss those key components of, your main roles as an infection preventionist. Over the past few years, we've had a lot of turnover on, the infection preventionist role. And a lot of the feedback that I get from infection preventionists is, number one, we don't have the time, the resources to do what we need to do. And also, a lot of times the role comes with a vacancy before they get there. They don't have that overlap with the previous infection preventionist, and they're not sure how to proceed, starting off in that facility. So this program will be those basics on, number one, how to put together your infection prevention program. And number two, those key components and leadership skills needed to, really thrive in your role. So information about that will be coming out shortly. Again, it's going to be piloting this fall, and hope to see all of our new IPs there.
And just one other thing that I received a question from someone is, and actually this was someone from a dialysis facility, but I thought, hey, I'll bring it up here today with all of you from the nursing homes. There was an issue, actually it was from the staff at the dialysis facility talking about their communication with nursing homes who were sending dialysis residents to them. And they felt that there might be some concern, issues, misunderstanding about how to handle the catheters, dressing changes, that sort of thing. And they've done some individual education, but we do partner with End-Stage Renal Disease Network, who would be able to offer a lot more education on, what to look for with a dialysis. So if that is something, that end-stage renal disease, communication with your dialysis facility, education on what to look for with the dialysis residents. If that's a topic that would be of interest, please let us know, and we will look at setting something like that up. I know sometimes a lot of that communication, is kind of communication is a big deal, and we will be talking about communication also moving forward, not just with among nursing home staff, but also the different healthcare settings. When referrals from hospitals to hospitals, dialysis facilities, that type of thing. One other partner that I wanted to mention is the Alliant Healthcare Centers of Excellence for Behavioral Health. We have them highlighted in our newsletter. I've had a call with them. I've talked to a couple of nursing homes who they're having, it's a different population that a lot of people are dealing with right now outside of the traditional long-term care population. There can be younger residents, those who are coming with substance use disorders. It's those behaviors that are even outside of the dementia. A lot of us have had dementia training. We've done dementia training with our staff, but we're up against this different type of behavior that not everybody is prepared to deal with. And you do have to look at, these mental disorders, substance use, treatment. It's different than what we've traditionally dealt with in long-term care. But I'm hearing a lot more of it. So that is something, Alliant, the Centers of Excellence, they have so many good resources, a good website. They're willing to offer at no cost assistance to nursing homes in Pennsylvania to educate staff on this very issue. So I just wanted to point out that that's something that's available also. Anyone else? A last call for questions, comments. As I said, please, when you leave the webinar, do the evaluation. Let us know other topics that you're interested in moving forward. But before we leave, and then I want to ask the rest of the team if anybody has anything that they want to add or talk about before we go.
Penny, first, I think I've got the website for Alliant, but I want to make sure I have the right one. Is it Center of Excellence for Behavioral Health and Nursing Facilities?
I think so.
Put a link in the chat. You click on it.
I have to see it.
No, that was the one that was in our newsletter. I just want to make sure.
Yeah, that would be the one then.
Organizations with similar names. And I also put in Jennifer Brown's contact in the chat. If you need to contact her with questions about infection control or about reprogram, her email is jbrown@qualityinsights.org.
And then I just like to throw out there, I see a lot of new names on this week. Typically these Wednesday webinars, we do have a standard topic and it's educational and we provide that. And then once a month we have open Q&As. And today, with it being after a holiday, and we knew a lot of people would probably be off Monday and then Tuesday, we're kind of just talking today and sharing with what we have upcoming and giving you guys time to answer questions. But those that are new, I didn't want you to think, oh, well, what are they really telling me here? So just wanted to throw that out there. Also, if you have any specific questions that you put on the evaluation that pops up at the end, because they are truly anonymous. So sometimes Penny and I look at them and I'm like, well, this person really has a question, but we have no idea who to answer or how to get that answer to you. So if you want to put your question in there, please include your name so that we can follow up with you, because if you don't, we have no idea who made that request.
Yeah, the evaluation topics, we will pull that out. We'll look at topics of interest, but if it is, we have had one or two people ask specific questions, and yeah, as Deb said, this is truly anonymous. We don't keep numbers, or we have no way of tracking. So if it's an actual question, or you can email any of us at any time also. if you have specific questions. But yeah, I know, and we do, for new people, we don't want you to think that we just come on here on Wednesdays and like hem and haw around. Really, usually with when we have questions submitted before for the question and answer, we usually get, it's usually a variety of topics, but NHSN, everything. Oh, and NHSN, I hope everybody, I'm sure that I understand that they did have it go down, I think on Monday, but it's back up again. So I feel bad for anybody that had someone come in and try to do any kind of reporting on Monday to find out that it was done. But apparently they did get that resolved so that you can get your NHSN reporting in there. So yeah, we generally have a lot more questions, but I do think with the holidays coming up and everything being busy, so we do really appreciate your feedback though, always.
Great, thanks, Penny. So I'll run over a couple closing items, and then if anyone has anything to add before we end or any last minute questions, go ahead and submit it now. Again, I'd like to invite everyone to next week's webinar, which will be a preview of a course that we'll have coming up in August of 2023 called Staffing Solutions for Nursing Homes. This will be the second cohort for that webinar, so you might have seen the overview webinar for it back in November or been a part of the cohort that did it this past winter. So it is now open, or it's getting ready to recruit for the next class. For those who are interested in learning more about that class or want to enroll in that class, should consider coming to next week's webinar at the same time and place. Amy Porter will be back to talk about that course, lessons learned from the previous course. And I have a flyer here for anyone who might be interested with a little bit more information. So that is now in the chat if you might be interested in coming to that webinar or learning more about that course. We also invite you to bring your questions to our virtual live chats every Tuesday and Thursday at noon for our, which are kind of like office hours. Deborah Wright will be there to answer any questions you might have on topics like quality improvement initiatives, infection control, or MDS coding. And you can find the links to the live chats and all of our webinars in the newsletter that we send out each Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on the mailing list, you can contact me at ccaudell@qualityinsights.org. And I will get you on the list, and I will put my email in the chat right now. And it looks like we don't have any further questions, so I think I can wrap us up. So before we sign off, I'd like to ask everyone here to please answer a short evaluation, the evaluation that Penny mentioned a moment ago. It will show up as a pop-up as soon as this webinar ends. And if you have a couple minutes to fill that out, we would really appreciate it. I'd like to thank all of our panelists for joining us here today, and thank all of you for joining us here today. And we hope to see you back here again next week.